After 2 decades, there's a new head doctor at the Simcoe Muskoka District Health Unit, and she's no stranger to our community. She joins us now in the CTV Barrie studio, the new Medical Officer of Health and CEO, Dr. Lisa Simon. It's great to see you again.
Thank you so much for having me.
How has it been adjusting to the new role, and has your last 13 years with the health unit lent itself to the new position?
Yeah, absolutely. It's been wonderful. It's really an honor, actually, to be the new Medical Officer of Health and CEO at the health unit. It's a wonderful place to be. We have such a strong, skilled, compassionate group of staff that really do the work of the health unit every day, and great, well-established relationships with the community. So I couldn't think of anywhere I'd rather be. And yes, absolutely, past 13 years or so that I've been at the health unit have been a wonderful base for me to be really familiar with the organization and with our local communities. And now I can just build from there.
Well, I have to say, even when you're surrounded by great people, this is some really tough stuff that you've had to focus on. And I know that you've put a lot of emphasis on substance use prevention, which is, very relevant for us right now. How are we doing as a region?
I'm a bit pleased, at least, to have something slightly optimistic to say more than usual, I think, on this issue. We have seen some degree of a decrease in the number and rate of opioid-related deaths in our region within 2024 and the first half of 2025 from what we know so far. So that provides us with a little bit of optimism. However, there is no doubt, and anybody who's out in the community knows this very well, substance use remains a major challenge, and drug toxicity remains a major challenge. Not only opioids, but many other substances in the drug supply, whether it be stimulants like cocaine or methamphetamines, or other substances like benzodiazepines. So people have a whole mix of what they're exposed to. And while we're seeing certain harms decline, we're seeing others, like related to things like cocaine, increase in terms of what we see in emergency department visits. So still so much work to do there.
And it doesn't stop there. You have focused on a number of really important things, including systemic barriers. And this is very relevant for us today, this week, when we speak about the Indigenous population.
Yes, absolutely. So this is actually Treaties Recognition Week in Ontario, which is an opportunity for all of us to stop and honor and learn more about treaty rights and responsibilities. Within the Simcoe Muskoka region, there's a very large Indigenous population made up mostly of First Nations individuals and Métis individuals living in all communities in the region, as well as in 4 First Nations communities themselves. And since about 2018, it's been an important priority of our Board of Health and our staff to increasingly get to know, build relationships with, and really over time develop very genuine partnerships with many Indigenous communities and organizations as we work together to respect the fact that Indigenous health needs to be in Indigenous hands, but our role is to be there to collaborate on public health programs and services when they're looking for that.
Something, Dr. Simon, that we have been talking about, not just here in Barrie, but really right across the country, is food insecurity. This has become a huge issue. What are you seeing? Is there a light at the end of the tunnel? What do we do about this?
Yeah, so unfortunately, I think, as we all know, as affordability in general, gets worse, people have less money for their basic needs and food prices rise. We are not surprisingly seeing that this issue is getting harder and harder. Part of our role in public health is to actually go out into grocery stores once a year and tally up what the cost is of affording a nutritious set of groceries every week for a family. And when we do that, yes, we see each year that the cost of groceries is going up, and that the money that people have available to them to purchase groceries is often going down. So
what are you doing in schools to try and promote education earlier? Nutritious education. Yeah,
for sure. I think a couple big things. One is just making sure that educators in schools have the materials to be able to talk about food. A second one would be working with schools to make sure that the food that's available in schools is actually nutritious. So we're not just teaching it, but that's actually what we're providing and making available. And thirdly, we work with schools on student nutrition programs to help that food access issue.
Okay, we'll leave it there for today, but I'm sure that, Dr. Gardiner was in the position for 20 years. So who knows, we could be talking for decades.
Sounds good.
I have been speaking with Dr. Lisa Simon. She is the new Medical Officer of Health and CEO at the Simcoe Muskoka District Health Unit.